Hi everyone and welcome back to my channel. Today we are talking about common fractures in plain X-rays. In this tutorial, we will cover key aspects of skeletal imaging from identifying fractures and dislocations and how to describe them in your report or medical record. So whether you're a seasoned radiographer or radiologist or even a student eager to learn, let's dive into this journey into skeletal imaging. Let's get started. Bony abnormalities, whether as a result of trauma or pathological process, are generally described and classified by their location, appearance, and degree of bony involvement. So when you're looking at X-rays, using the right words and being super clear about injuries and stuff is super important. And when we talk about the body, we always describe it like it's standing up straight, arms at the side, facing forward, just like this picture. So it's called the anatomical position, and it helps avoid any mix-ups. Now, there are three main ways we can slice up the body called planes. The axial, which cuts the body horizontally, so you get a top half and a bottom half, superior, inferior. Then there is the coronal plane. Think of it as slicing the cake from front to back. So you end up with a front slice and a back slice, anterior and posterior. And lastly, the sagittal plane, picture cutting from the middle. So you have a left and right piece, right? Easy. Okay, and then we have several terms when describing the location of a fracture. Anterior, towards the front. Posterior, towards the back. Superior, above or on top of something. Inferior, below or underneath. Lateral, away from the midline. Medial, towards the midline. Proximal, nearest to the trunk. Distal, furthest from the trunk. We have palmar relating to the palm and plantar relating to the sole of the foot. So, and when we're describing a long bone, it's divided into third, the proximal, the middle, and distal third. So, fractures are pretty much labeled and sorted out by where they happen and how big they are, which way they go, and how many pieces they break into. So different parts of a skeleton have their own ways of talking about fractures, but we will dive into those specifics later on. So the direction of a fracture line is determined by its relationship to the long axis of a bone. So you got transverse fractures, where the line goes straight across the bone. Then we have oblique fractures, where it goes at an angle. We have spiral fractures, which twist around the bone like a spiral staircase. And the next one is longitudinal fractures, are usually part of a big mess of pieces in a comminuted fracture. So, and we have fractures can also be displaced, where the pieces aren't lined up like they should be, or undisplaced, where they're still in place. And don't forget to mention any soft tissue stuff like swelling or fluid around the joints when you're talking about what you see. So when a bone breaks all the way through into two or more pieces, that's what we call a complete fracture. But sometimes, especially with kids, you might see an incomplete fracture, where it's like a crack but not a total break. And now let's talk about comminuted fractures. These ones are a bit messier, with two or more lines and three or more pieces. how bad it gets usually depends on how much force caused it. And with long bones, you might even see what's called a butterfly fragment, which is like a small piece of bone that's kind of hanging out on its own, as you can see here in this humerus x-ray. In a segmental fracture, it's like a chunk of the bone's shaft gets isolated by breaks at the top and bottom. We have compression fractures, which happen when something squishes the bone, and they're pretty common in places like the spine, heel bone or calcaneus, and tibial plateau. Now, here's the deal when we're talking about open and closed fractures. If the skin's not broken, we call it closed. But if there is a tear, it's open, obviously. And if there is air around the break, that's a sign it's open too. This could happen if something sharp pokes through, like a broken bone piece, or if there's been a big injury like getting shot or stabbed. You will see air level in the soft tissue. Okay, we have evulsion fractures, which are small bits pulled from bone bumps by ligaments or tendons. Sometimes they're big, wrapping around the whole bump, or small flakes. Intra-articular fractures sneak into the joints, extending from the bone shaft or primarily affecting the joint itself. Spotting if a fracture is in a joint is key when looking at images, and bear that in mind. Think of stress fracture as a crack in bone that happens when it's put under a lot of repetitive strain, like suddenly doing a ton of exercise your body isn't used to. There's usually no big injury forehand. For instance, in the foot, pushing it too hard or changing your activity level can lead to a stress fracture in one of the metatarsal bones. At first, when you take an x-ray, everything might look fine, but if you look really closely, sometimes you can spot a super thin radiolucent line, like a hairline fracture. That shouldn't be there. It's only after a couple of weeks when you took another x-ray that you might see what looks like a fluffy big around the bone, which is calcification around that hairline fracture. In some cases, you might also see a line of denser bone inside, which called endosteal sclerosis, showing that the bone's starting to heal up. This kind of thing usually shows up in stress fractures of the calcaneus and the tibial plateau, of course. And insufficiency fractures happens when you're just going about your day, but your bones are weakened due to some illness. These fractures often showed up in folk with osteoporosis. One classic example is when older women end up with pelvis fracture in the pubic bones. So similarly, insufficiency fractures can pop up in people dealing with conditions like rheumatoid arthritis, renal osteodystrophy, osteomalacia, osteopetrosis, and Paget disease. Okay, and now that we've covered the theoretical aspects of common fractures, let's put on our knowledge together to test with some practical examples using X-ray images. So the first X-ray is of a 74-year-old with severe pain and inability to weight bear following fall. How do you describe this fracture? It's an AP of pelvis, let's say hip AP, and HBL, which is horizontal beam lateral. Okay, so as you can see here, there is a transfer fracture, transverse, and by transverse, as we mentioned, we compare it to the longitudinal line of the bone, not the body. So it is transfer of the line that we draw from the femoral head to the femoral neck, which is perpendicular to it. So it's a transfer fracture through the right neck of femur with minimal impaction of fracture site. All right, the next case, 45-year-old male fall onto outstretched right hand, pain at the base of thumb. Okay, we got two pictures, right thumb, AP and lateral. Okay, as you can see, the fracture happens inside the joint, so it's an intra-articular fracture of the base of the first metacarpal, and you can see the dislocation to the dorsal area with dorsal dislocation of the first metacarpal. So this appearance suggests a Bennett's type fracture. Okay,